Welcome back to the Next Gen online video tutorial series. In this video, we're going to go over navigating your way through this assessment and plan screen, which you can find under your SOAP Pill tab. Before we jump into assessment and plan, I just want to point out a few ways that you can access this screen. Firstly, you can go ahead and click on this quick link here called My Plan, and it'll bring you right into the assessment and plan template. Or after maybe doing your physical exam, you can then access the template just by clicking on assessments or any one of those. Another area is going to be under checkout. By coming to checkout, you'll also find that quick link called My Plan, or you can jump right into the lab section of the assessment and plan template. And then also, if you're in Finalize, if you were to notice that under your assessments you forgot one and you wanted to just quickly get back into the screen, you go ahead and click Add here, and this will bring you back into the assessment screen. So now that we know a few ways to get here, let's go ahead and talk about the first three tabs. For the sake of time, I'm only going to get into the assessments, My Plan, and AP details, and then in a separate video I'll finish off the rest of this screen. Firstly, the first thing you want to know in assessments is basically this is where you're going to come to add in new assessments. This box here entitled Billing Diagnosis History, mainly this is just going to be a summary of all of the previously billed assessments that have been documented within NextGen. So since this is a test patient, we can see quite a bit of assessments have been added in. Clinical problems, this is going to be any assessments that we've marked as on our problem list. So they're usually chronic. The patient has had these assessments multiple times and they've now been labeled clinical problems. And then this is the My Favorites screen. Under My Favorites, this is where, for example, if you are part of a diabetes clinic and a lot of your patients are diabetes type 2, then you would probably want to add a diabetes type 2 assessment into your My Favorites, so that way you don't have to search for it each time and you can quickly access it here, for example. So now that we've explained these three screens, the other place to find diagnoses that have not yet been entered in NextGen, so let's say a new diagnosis, for example, you come here to Diagnosis Code Lookup. Once you click on Diagnosis Code Lookup, you basically get like the Google search of diagnosis. So we'll go ahead and just type in one, diverticulitis. And we see it pulls up our assessments, and this is where I want to mention staying away from assessments that end in .00. You want an assessment that has some numbers after the decimal point, and this is for billing purposes. The more specific the assessment, the better. So we'll go ahead, select our assessment, and now we notice it populate here in this middle area. However, we don't see it added to our box entitled Today's Assessments just yet, and that's because we haven't hit Add Update. But before we hit Add Update, let me just quickly draw your attention to these boxes here, and this is where we can mark the diagnosis as chronic. We could add it into our clinical problem list here, and then we can add it into My Favorites here, for example. So we'll go ahead and pick My Favorite One list. And now that we've highlighted all these boxes, you don't have to do this for every assessment, but just for learning purposes. Now that we've done all that, we go ahead, hit Add Update, and we see our assessment add into our Today's Assessment box. That means we captured the information, and we said we added it to our favorite one list. So we go ahead, My Favorites, enter our favorite one list, and we see diverticulitis was added. I'd also like to point out, say you have a lot of favorite diagnoses, you can use this filter button to go ahead and type in whatever it is you're looking for, and it'll pull it right up for you instead of scrolling your way through. Okay, so just to highlight this screen, the Assessments tab here, You have your billing assessments that you've done in the past. You have your clinical problems, your favorites list, how to look up new diagnoses under diagnosis code lookup, these boxes here to add into any of these screens, and then add update to make sure your diagnosis actually gets captured under today's visit. Okay, let's move on to my plan. And we see the assessment that we added is here. So once we highlight our assessment, we're going to go ahead and get a list of pre-generated lab orders, diagnostics. Sometimes there's office procedures and office labs along with instructions. And all of these are going to be pre-populated, and they'll vary between assessments. So for example, let's just say we want to add in another assessment. We'll say in this case asthma. We'll jump back into my plan, and now once we highlight asthma, you can see there are no lab orders or any pre-generated instructions or procedures here. So with that said, let's see, going to diverticulitis, since we do have some lab orders. Mainly what I want to point out here is that this is a quick way to order some labs. Say for example you only want a BMP order today, then sure, go here, check the box next to BMP, place your order, and you're done. You don't have to go to this lab screen later, which we'll get into in a separate video. The main takeaway though is if you see what you want and you don't want anything more, then go ahead and quickly do your labs or a diagnostic here. But if you don't see what you want, then you're going to have to start entering in this lab screen or this diagnostic screen. Beyond that, this is also where we can type in patient instructions. So we go ahead and highlight this, place the order, means we capture those instructions. And most importantly, this is going to be the only place that you can schedule a follow-up visit. It's going to be under this My Plan tab. So once we check into this box, we only worry about this area here right under follow-up time frame. And this is where we can choose our provider, whoever it is that we want to follow up with. We can choose a reason, and if it's not any of these, you just cancel out and go ahead and free text the reason. Time frame, when you want the patient to follow up, press OK, and as always we want to make this checkbox disappear by hitting place order. So main takeaways from the My Plan screen are going to be just like a cheat sheet for quick lab orders, diagnostics, procedures, whatever the case may be. If you don't see what you want, then you go ahead and come to this lab, diagnostics, or referrals tabs. And in addition, this is going to be the only place that you can schedule up a follow-up visit. You can do a referral here, but I strongly suggest only scheduling referrals within My Plan if it's going to be for an in-house referral. And this is where you'll only worry about the information here under referral timeline. So for example, you wouldn't want to order your referral to a cardiologist, for example, under My Plan, because you want to write in your clinical comments and you maybe want to add in some attachments, and all of that type of more in-depth information is going to be done under the referrals tab. Whereas here, if you just want to do an in-house referral to, let's say, our psych clinic called Edelman, then we can go ahead and just type in refer to Edelman, reason for treatment, which we picked from here, treatment, and then time frame, same as always. Press OK, make the checkbox disappear, place your order. And you can see that's just a very quick way to do a referral, but it doesn't get very in depth with clinical comments or attachments and all of that. So those are the main takeaways from the My Plan screen. When we get a little bit more involved, we can go ahead and start customizing an order set for a diagnosis by going to save order set, but that's going to be in a separate video. So under AP details, this is where we're going to find our today's assessments, and you're going to want to highlight each assessment. So for example, if We jump back into the screen and we haven't highlighted assessment yet. All these boxes are going to be grayed out, and this does not allow us to type anything in. We have to go ahead and highlight an assessment before we can do that. Under impression and comments, this is where you're going to write your clinical findings. It's pretty self-explanatory for the doctors. Differential diagnoses, this is where you would put these. And then let me go ahead and explain patient details versus provider details. Patient details are really going to be your instructions for the patient or a quick summary of what you talked about today. So, for example, putting here, avoid fatty foods, suggest more diet and exercise, stay hydrated, stuff like that that you want the patient to read over. Put it in patient details because it'll appear in the patient plan that's generated by the coordinators. Provider details, on the other hand, as you can see here, will not print out on the patient plan, and this is more going to be a note to yourself saying, you know, patient was a bit combative today, or something along those lines where you don't want the patient to see it. But please be aware that whatever you type here will be available to the patient if they request their records at a later time. So in quick summary, AP details is really just where you're going to go ahead and put in your comments for each diagnosis and start typing up your patient details. And that summarizes the first half of this AP details template here, working our way from assessments through my planned AP details, and we'll get into the rest in a separate video. Thank you for your time.